Some pediatricians will ask you to find an adult provider for your child soon after their 18th birthday. Others will continue to see your child until age 21 or even older. If your child has specialty care providers, you'll need to consult with each of them as well. It's important to prepare your child for the transition to an adult provider. Start talking with them as early as age 16 about their options.
When Hunter was around 15 or 16 years old, I wanted to make sure that he knew that that doctor was his, because up until then, I mean, with pediatricians, they ask the question of the parents, and the parents answer for how the child's doing. And so I wanted to make sure that Hunter understood that this was his doctor. So I talked to his doctor before his next appointment, and I said, you know, I'd really like you to spend a little bit of time alone with Hunter during this appointment, just so that you can build that relationship with him. And he asked me a very interesting question. He said, why? And that made me stop. If I had to explain to him that I wanted that relationship for my son with him, that maybe I needed to reconsider who Hunter's doctor was. Interesting enough, I also asked Hunter to spend a couple minutes alone with his doctor, and he gave me the same answer.
Yep, why?
And so I explained to him the whole thing, that he was going to have this doctor for, you know, for a long time. So I introduced him to my family doctor, and they hit it off.
Yep,
and
we just clicked like a missing piece of a puzzle.
So Hunter started seeing him, and we would go together in the beginning, and then eventually Hunter kicked me out of the room.
Yep.
And he just goes to his appointments alone now.
I think I started spending time alone with the doctor when I was about 13. Like, when they told my mom to leave, I was like, do they think I did something bad? Like, why is she leaving? Like, I thought, for a minute, I thought they expected me to, like, say all these, like, horrible things I've been doing. But then I just kind of realized, like, oh, this is, like, good. Like, if I ever feel like there's something I need to say, but, like, I can't say it around my mom, this is, like, a safe place. And so I guess, like, once I realized that, I kind of was, like, thankful that I had the opportunity.
If my doctor said I want my mom to step out and talk to me alone, I would be kind of iffy about it. I'm kind of nervous, maybe.
I would say you have nothing to be afraid of. The doctors are all here to help you and to help you stay safe and healthy. And even if you have done something that you feel is, like, bad or wrong, they won't judge you for it. They just want to keep you safe.
Well, once Sam reached the age of 14, we started having more conversations about what's going to happen in the future as he becomes an adult. We're 4 years away, and there's a lot that will have to happen between now and then. One of the biggest things for us is that Sam has 12 doctors. And we will need to find replacements for 12 doctors. Individuals that all can communicate with Sam, that are familiar with his medical complexity, and are willing to work with an individual that has some pretty significant issues.
Starting around 15 or so, we have sickle cell clinic, and it's usually twice a year. And they would take the teenagers off, and they would start talking to them about transition care and what they need to do. Is like, do you all know what medicines you take? Do you know who your doctor is? Do you know how to do your refills? Some of the kids didn't know their medicines. And the doctors really started trying to push the kids to let them know, like, these are really important things that you all need to start taking care of.
As to how to approach the whole transition, primarily that you don't have to approach it all at once. And you can start early. Just think ahead. Start jotting things down. Do you have questions? Do you have notes? Rely on those professionals. Also rely on other parents around you. Over time, you kind of get to know other parents who have children in similar positions. And the more advanced planning you can do, the easier it is. And if you can just kind of break that up into little chunks, it becomes less overwhelming.
Overall, my only suggestions to everybody is take your time.